Minglava, I am Dr. Tarun Jindal, Senior Consultant of Uro-Oncology and Robotic Surgery at Apollo Multispeciality Hospital, Calcutta, India. I will be speaking about the evolution of urological surgery with special stress upon the robotic surgery. So we urologists deal with cancers of kidneys, prostates, bladders, penis, and so on and so forth. The commonest symptoms of any urological issue are problems with urination, or if somebody has blood in the urine, or if there are certain pains in the flanks on either side or in the lower abdomen, or if there is any burning during micturition, or during routine examination if your PSA levels have been found to be high, or you notice some lumps and bumps in your abdomen or in the testicular area. So we treat any kind of tumors which involve urological organs. The surgery for cancer is an extensive surgery. So conventionally, they require big incisions on the body. And you can understand that if the incision is big, the patient is going to have higher amount of pain. He will be hospitalized for a longer duration. The blood loss will obviously be higher, and the time taken by the patient to come back to his normal activity will also be longer. With the advent of open surgery, large procedures were possible, but now the same procedures are possible with the help of robotic surgery, in which we give very small incisions on the patient's body. These incisions are to the tune of 8 millimeter. So just imagine if I have to open a surgical procedure for a kidney cancer, so my incision will extend from here till here, which is approximately 30 centimeters. With the advent of robotic surgery, I will be able to do that surgery by just 3 or 4 8 millimeter incisions. The recovery of such patients obviously is fabulous. The time of hospitalization for major procedures has now come down to just a couple of days. It is especially important for people who are traveling from Myanmar to our center. By the virtue of robotic surgery, we can decrease their hospital stay, we can decrease the time which they need to spend in Calcutta, and they can be back in no time. They would approximately in a week or so, they are good to resume their duties, and hence the amount of expenses, the amount of duration you are supposed to be away from your home is significantly less. Coming to the oncological outcomes, that is the cancer outcomes. So robot, by the virtue of numerous technologies as well as addition of artificial intelligence, is able to make us identify the cancer cells. So we can excise only the cancerous part and we can save all the other organs. This is specifically important in patients who have kidney cancer. So now with the advent of robotic surgery, we are able to just remove the tumorous part of the kidney and we are able to save the entire kidney. So we are stressing on the concept of save the organ rather than taking the organ out, because every organ which God has given us has a specific purpose in the human body, and we should do our level best to preserve the functionality of that organ. For prostate cancers, earlier we required large incisions. The patients were there in the hospital for 2 to 3 weeks. Now they are going back home within a week, and the hospitalization duration has decreased to just 2 days. And in certain cases, we are even able to discharge the patient on the next day. This was absolutely unheard of in the era of open surgeries. So my message for you is, please don't be afraid of cancers. Urological cancers can very well be managed. Do not be afraid of your symptoms. Whenever you have problems, please consult your doctor. He will be able to guide you through, and always discuss the option of robotic surgery in your case. At present, I believe there is every surgery which we can do by robotic approach to give you the best of the functional as well as the oncological outcomes. Thank you so much.